All right. Well,
Hi, how are you, Gail?
good, good. Well, you just let me know when to start, when we have enough folks.
You can start now.
I just can't, I don't understand this.
Do we have enough people on?
Not yet.
We have 19 folks on the
Oh,
call.
we do? Woo.
Yeah.
Well,
Yeah, so we can get
Is it-
started.
is it 11?
It is.
All right. Okay.
Gail, you can start.
I
with
will.
the
Yes. Welcome, everyone. We're so excited to be with you again. And thank you so much for your engagement in our Leveraging Hope initiative. It's been wonderful over the last several months to hear from all of you, to learn what's going on in your communities and to figure out together how to use data to help just support your efforts and make your efforts more effective in your communities in terms of policy changes and organizing. You know, data helps us reframe the narrative. And so we're really very excited to be engaged in this process. And I want to thank the team members, Luz, Yvette, Bethlehem, everyone that's working so hard to make this happen. So welcome again on behalf of the National Collaborative for Health Equity. And I'm going to turn it over to Luz.
Yes.
Mhm.
All right. Welcome, everyone. Love seeing all the new faces and looking forward to our presentation today from Louisiana Center for Health Equity and Equity Matters in Baltimore. We want to start introducing ourselves, which I see some of you have already started, and I want you to also add one thing that has stood out for you in past presentations. And I'm writing the question in there so that you remember what's in previous presentations. So you can continue saying hi to each other and then just add that for us. And I'll read a few as we go along. Let me know my time, Bethlehem, okay?
Sounds good.
I see California's on the line. We'll be off camera. What is participating? Hello from Kevin. Hello from Michigan, from Lansing and Cleveland, Myron Bennett. Let's see. So we have Sarah Wooton. I hope I pronounced your name correctly. She's from the Partnership for Public Good in Buffalo. One thing that has stood out for her in the past presentation has been folks' excellent use of data visuals in conveying their message. Thank you, Sarah. Welcome, Kevin Collins, who's standing in for Karen Siegel from Connecticut. Emily, thank you, Dr. Cinnamon. She says what has stood out for her is the energy and momentum of each group. Thank you. Others are saying, how different ways that people across the country are addressing health equity and how different and similar the struggles are. Thank you for that.
Liz, we have one more minute.
1 minute. Hi, John Davis from the Louisiana Center for Health Equity. Anyone else want to share? Okay, you can continue doing so if you like. We're going to go now to Okay, Susan Avila from Cook County says what's been impressive is all the good work linking data to action. Thank you, Susan. All right, I think I'm going to turn it over to Yvette to go over the agenda.
Sorry, y'all, there's a delay on my internet for some reason, so things are taking a little longer than I thought. Good morning, everybody. Welcome to our June Leveraging Hope Teams meeting. Just wanted to take a minute to go over our agenda at a high level. So we're in the phase of doing our welcome and introductions. We will have presentations from Louisiana Center for Health Equity in Baton Rouge, Louisiana, and Equity Matters from Baltimore. Luz will discuss the Leveraging Hope team expectations, which are local area of policy work for this effort, data sources for narrative change, data-driven rationale for goal for progress, and then distance to goal in specific geographic areas. We will then have Louisiana Center for Health Equity to take us through their presentation, followed by Equity Matters. We will have our breakout groups, and our questions for breakout group today are to discuss how the data issues that surface in the presentations could inform your work for an equitable recovery, and then to discuss other ways you might use data to drive and support your local action. Then we will have our reflections and closing.
Okay, thank you, Yvette.
You're welcome.
Since Yvette has already gone through the expectations, it's the same as always with all of the teams. So we're going to hone into local focused area of policy work for this effort. Figure out what data sources help your organization to create the most compelling narrative for change to increase health equity. Identify and create a goal for progress that has a strong data-driven rationale. And quantify your distance to goal for population groups in a specific geographic area. We understand you don't have all of this, but learning where you're at, what are your challenges and how you're getting there is really the intention of our community of practice as we go along and complete this for our team. So Bethlehem, you want to remind people of the technology?
Yes, and Yvette, you can stop sharing the slides. So I will be giving a 1-minute warning at 19 minutes, a verbal warning just to let you know that you have 1 more minute left for the presentation, as well as when time is up at 20 minutes. And then we'll have 5 minutes for Q&A for each presentation. So I will happily pass it on to the Louisiana Center for Health Equity, Angela Stewart Allen, to begin her presentation.
Thank you, Bethlehem. Angela, you're on mute.
Unmute. Good morning, everyone. Can you hear me now?
Yes.
Okay, thank you so much. My name is Alma Stewart Allen. So,
Oh, sorry about that.
And we're very pleased. Good morning to everyone. We're very pleased to, have this opportunity to present this morning the learnings of our work thus far. This has been an awesome journey already. Our presentation focuses on children, youth, and adolescents through the lens of Louisiana's youth is our starting point. And I'll go through a few slides just to give you a little context. The Louisiana Center for Health Equity is a nonprofit organization that's dedicated to improving the overall health and well-being of all Louisianians. We work to eliminate health and healthcare disparities attributed to structural, institutional, and social disadvantages. We were established in 2010. So I just want to say that our biggest accomplishment over these years that we're known for most is our work in the access to healthcare space and advocating for Medicaid expansion. Louisiana still is the only state in the Deep South that has expanded Medicaid. So our focus for this project is to look at youth, the children, youth, and adolescents using 3 data platforms. We use America's Health Rankings, Healthy People 2030, and the National Collaborative on Health Equities Leveraging Hope data platforms. So we are, in this context of focusing on children, youth, and adolescents, we are working to mainly impact the determinant of health education. And we have been fortunate to, this past legislative session that just ended on June 6th, to get a study resolution passed that allows us to bring together, to convene, to be the convener for a collaboration of major stakeholders in the space of education and school environment, school policy, and mental health. And so we're excited about that. I'll talk more about that. So I want to give the bigger picture of the work that we're doing and how all of this fits together. In 2019, Louisiana ranked 49th in health outcomes. We or 50th, was it 50th or 49th? 50th, I'm sorry, in health outcomes. And we decided to launch our bold vision, which is the LA 40 by 2030. LA 40 by 2030 basically is, the vision is to improve the health outcomes and quality of life for Louisiana children and families over this decade. So the goal is that Louisiana will be ranked 40th by the year 2030. We identified several core, 6 to be exact, core indicators, health or KPIs, key performance indicators, using Healthy People, America's Health Rankings, excuse me, and they're listed here on the screen: high school graduation, obesity, smoking, low birth weight, cancer, death, and concentrated disadvantage. Since we're focusing on children, youth, and adolescents, we chose to focus on those that were related more to that, that population for this project. So as we looked at and compared the different data platforms, looking at the Leveraging Hope platform, and let me just back up and say, initially for the LA 40 by 2030 bold vision, we are using primarily America's Health Rankings data or key performance indicators, and as a secondary, Healthy People 2030 data, mainly because one of the reasons we're using it in that fashion is that Healthy People 2030 only reports national data and targets, not state data. They do not have state level data. So in looking at and comparing the Leveraging Hope data, we identified 3 domains that we're focusing on, and those domains are social and economic factors, of which of course education fits into that domain, community and safety factors, and physical environment. And here you can see where we currently stand and the related performance measures or performance indicators in each of those domains from the Leveraging Hope data indicators. I'm going to go more into detail about that. So as we compare the various data sets, the data platforms, the 3 platforms, and we did a pretty robust comparison and prepared a crosswalk of those data platforms that helped us to hone in on these KPIs that we chose for this project that allow us to take advantage of the Leveraging Hope data platform. Because there are some unique features to the Leveraging Hope data platform that are very useful to us in our work. So we chose these 5 as the KPIs for our children, youth, and adolescent work. So education, And with education, it's mainly high school graduation, but it will be a little broader because using some of the information, the data from Leveraging Hope, we see where we can expand our reach there in terms of the areas that we are focusing on and can work to impact from a policy and a systems change perspective. Children in poverty, food insecurity, concentrated disadvantage, and adverse childhood experiences. So those are the 5 that we're focusing on. Louisiana is one of the poorest states in the United States. Most current data that we have looked at, 46% of Black children in Louisiana are in poverty. So we know it's a huge disparity issue especially for Black children in this state. Food insecurity is also prominent in this state, and adverse childhood experiences is also a major issue, given that we really are in a public health crisis when it comes to the mental health of our children and youth. And we see the indications of that, not just here in Louisiana, but also across the country, where the Surgeon General has basically declared such, as well as the American Pediatric Academy has already also declared such at the latter part of last year. So those are the key performance measures that we identified. They are all very, very important in the context of the current environment in Louisiana, looking at those various domains that I talked about previously. I'm going to go through this rather quickly and then hopefully have some time to elaborate based on the questions that you all have. So I hope you can read this. I know it's kind of small, but this is just to show you, to illustrate. It's a table illustrating the crosswalk that we did. Not all of the steps that we went through to get to this. We actually did 3 different sets of analysis or comparison of the data and drilled it down to this table so that we could share with you what our findings were. So looking at America's Health Rankings 2020-19, that's our baseline year for the LA 40 by 2030. And again, children, youth, and adolescents are a major demographic, a priority demographic, as well as women. Those are the 2 population groups that we are really focusing on from a population health standpoint in our work right now with LA 40 by 2030, because we see that and believe that improvements in those areas are what will drive overall improvements in health outcomes in Louisiana. And so you'll see the 5 key indicators listed down on the left side of the screen, the first column, and then the health measures related to those, what the baseline was in 2019, where we stood in 2021, which is the most recent data, and then what the target is for 2030. I think we may be missing some of the some of them did not actually have targets from Healthy People, from America's Health Rankings. There was not a 2030 projected target, only for the ones that were the 6 KPIs. And of those 6, we chose high school graduation and children in poverty. The other KPIs came from the America's Health Rankings Women and Children's report, and they did not provide targets for 2030. So you see food insecurity, concentrated disadvantage, and adverse childhood experiences that came from the Women and Children's report. Then we looked at the Healthy People 2030, the national data and the targets there. And we compared all of those also with the Leveraging Hope data. So just to say a little bit more, and Kwanzaa can jump in and also answer any questions here too, and also provide additional context. Excuse me, I'm getting tongue-tied, because she did the lion's share of the data analysis and comparison here. So what we saw is, can we move that out of the way? Put this just click on the one that says only the speaker. Yeah, thank you. Okay. All right, so one of the things that we really see as a nice feature of the Leveraging Hope data is the distance to goal data or feature. Also that it is state level data, and that it also provides data elements that are what I would say are actionable in terms of providing the data in a way that makes it concrete as to what action needs to occur in terms, and I don't mean specific actions to get there, but I mean, and for example, with regards to post-secondary education, we're at 50% of adults now that are, pursuing that. The goal is 83%. We need 1 million more Louisianans to be in post-secondary education. That is significant and a great target for Louisiana. And it also is a way of us thinking about, and we already were thinking about it, we just had not gotten there yet, but this helped us to get there in terms of thinking about, so we're focusing on getting them out of high school. We're also working on a partnership with the University of Louisiana system, which is the system of colleges and universities in Louisiana, to increase college enrollment and matriculation specifically for African-American males. This was useful in helping us to think about that. Now, this is not broken down. I did not see, and Kwanzaa, you and someone can correct me if I'm wrong, where this the HOPE data is broken down by demographics. So and maybe it is, that's something that we can look further into. So for that population, if we're targeting specifically Black males for increasing, their post-secondary education outcomes, then we would need the data broken down even more discretely by demographics. So that's an example of how we are able to utilize the HOPE data. So we added post-secondary education, we added youth in school or working as 2 additional KPIs, in addition to high school graduation rates that we had already incorporated into our project, our work. So now under education, we're looking at incorporating those 3 health measures, which gives us a more comprehensive approach to how we hold ourselves accountable, and how we think about and work towards improving education in the state of Louisiana. Okay, 5 minutes, wow, okay. You can skip that one. She told me I have 5 minutes. Okay, so just to give a little bit more context, we have been working with youth now for we started our youth initiatives in 2011. Our first actual youth initiative was hosted in 2014 with the Youth Peace Olympics. And shown there, I won't go into all the details, but shown there are the 4 different initiatives that we currently have, which provide a very pretty comprehensive focus on our youth work, from the community level, which is the Youth Peace Olympics, the first 3, the Lifeline and LEAD, are all interventions with youth primarily, but youth and parents and youth and families involvement. The LA Reach is the outgrowth and a more recent initiative that we have started that focuses on implementation of, it's a pilot to implement the kind of systems changes that we have come to understand are critical to the needs of our youth, as well as to our work with the LA 40 by 2030. Okay, just a little bit about real stories. In our LEAD program, we heard firsthand from students from across the state, high school students that were participating in our program. It's a leadership and advocacy program that was actually funded under the brainchild of Dr. Christopher through the Truth, Racial Equity and Racial Healing Initiative from the Kellogg Foundation through a foundation here in Louisiana. And I'm not going to have time to play the little video clip here of this 15-year-old who really told us a compelling story, her own testimony in her own words about how she was treated when she went to her school and told them about her, her thoughts of suicide. And she was suicidal. She was seriously contemplating suicide. They were going through a lot of things, her family. And the school, as she said, treated her like a walking hazard, basically sent her home, treated her as though she was a threat to the school and the other students, did nothing to intervene or assist or support her. Just, wanted her away from the school environment so she wouldn't harm anyone else. No concern about her. She was further traumatized. Anyway, through that project, they identified all of these concerns, narrowed it down to 5 priorities that are listed here. All of these priorities really, as in their words, somehow related back to mental health and the lack of resources to address or respond to the mental health challenges of our young people, which present and show up in school environments. Louisiana has a very punitive school disciplinary policy. One is one of the most punitive, and so we are really working to address that. So what we heard from them is that there are some policy implications, and these are the 3 policy recommendations that we put forth this year with the legislative session, in the 2022 legislative session. The first one is to require adverse childhood experiences screenings in schools before children are sent home. For example, if they had screened this young lady and taken the proper steps to assist her, it would have been more appropriate. Thank God she didn't commit suicide, but in that situation, she could have gone home and literally killed herself.
Alma, you have 1 more minute for a presentation.
Okay. Okay, so you can see the other recommendations here. The third one, creating the task force. We were successful in getting the task force created. We will be convening that task force on before the July 18th, and we will wrap up our work of the task force by January 23rd. We will be addressing the issues of school disciplinary policy, mental health, and mental health and this school discipline. You can keep going. Okay, so I'll really stop there since my time is up, and I'll take any questions from this point. Are there any questions?
Thank you so much, Alma. If there are any questions, feel free to drop them in the chat or unmute yourself. I can tell you so far, Claudia reacted to the 46% statistic that you sent. I believe that was children in Louisiana who are living in poverty.
Black children.
Black children, thank you, in Louisiana who are living in poverty. Are there any other comments or questions on the presentation Alma just provided for us?
I'm going to say it was really thorough and helpful, I think. And I believe all of the data for HOPE is disaggregated by race, but we'll offer you some TA to see if we can't dig that data up for African-American males in post-secondary education. I believe it's there, but we'll follow up on that. And the presentation was so comprehensive. I'm wondering, are you able to break down by county, for instance, where there's the greatest potential for change or the greatest population density?
We have not really broken it down. We haven't gotten that far in terms of looking at county by county. That's a good suggestion, though, and that's a next step in the work is to get to the regional, and regional would include county level data.
Okay. Thank you. Great work.
Thank you.
How many minutes do we have more, Bethlehem?
We have 2 more minutes for Q&A.
Any other questions? If we don't, I'd love to hear at least one of your lessons learned that you didn't get to, Alma.
Okay, with regards to lessons learned, one of the things that we saw is that the various platforms have unique features. As you could see, the Healthy People 2020 is only national data, but they do provide targets. We learned that data, well, we know this already, but one of the things to point out is that the different platforms are unique. There was only one data, the one key performance indicator that was consistent across the platforms, and that was infant mortality, I believe, where the data was reported the same. So, that presents some challenges as well for us in this space. But also, again, I'll say the feature of leveraging hope that we found most useful was the distance to goal feature and the focus on policy, actionable policy that we can really implement in terms of, advocating and which we do. That's a major function of our organization is policy advocacy. So that was very useful. The other major takeaway was that there was limited data on children, youth, and adolescents, especially in the Leveraging Hope platform. And one recommendation that we would have would be to look at and to consider adding data elements, KPI, performance measures or indicators for children to the Hope database.
Thank you, Alma. Thank you. I think we are now ready for our next presenter. That was amazing, very interesting. Kind of left a heavy space in my heart to see such high numbers for Louisiana.
Yes.
I commend you on all the incredible work you're doing.
Thank you.
Yvette, you want to present our next presentation?
Yes. Thank you again, Alma. Michael Scott and the Equity Matters team from Baltimore, Maryland is our next presentation. Michael's queuing up his slides now. And when you are ready, Michael, you have the floor.
Thank you. We'll get right to it. Let me get my timer on because I know time is of the essence. We have a few folks that'll be contributing. So I want to acknowledge Dr. Sabria Dennis at Morgan State, Donna Brown, who is our longtime organizing partner in many sectors, and as well as Dr. Antoine Wallace of Urban Research Strategies, as well as the National Innovation Service. So we were thrilled to be invited to participate. Leveraging Hope fits with our equity leverage framework. And of course, you all know we're longtime Place Matters, formerly Joint Center, then the National Collaborative, and then my Kellogg Fellowship really enhance our approach to networks. And I'll just say at the outset that, I'm trying to move slides forward. It is not moving. But I am at the outset going to say that most of our work is focused on equity, but also networks. And Equity Matters is a network, a community of and culture of network and network practitioners. And so the way that we approach is always through networks, right? And that's a big difference to how others are used to. I'm going to have to not maximize my screen to be able to move through this. So sorry in advance, but you'll have the slides. So our equity leverage framework really looks at some key components that go to where we are, meeting people where they are. What is your mindset? What is your toolkit? And then you have strategies, right? And then we get to equity behavior, which then looks at the gap between your intention and your actual outcomes. So I just want to start out by saying that's the model for which we move in the world. So we can do an equity audit, and we have many tools and trainings that go before we get to strategies. So it really fit the Leveraging Hope, because in Maryland, there's nothing wrong here. I mean, look, we're not too bad. We're health outcomes 13th, 5th in socioeconomic factors, of course, but we find some spots, but we know that's not true, right? So what we needed to do is to figure out how we could really move and get granular. That's one of the real things that is connected to applied complexity. And so we're looking at 780,000, let's call it 800,000 people, not including children. So if we wanted to move 1 million people, right, we have to do that only through organizing in our estimation, right? So even in the racial equity, we don't look that bad compared to the other states. And so one of the things that we wanted to do was to talk about what our network knows, right? Because depending on who you ask, that may not resonate. So, the idea of a lever goes back to Archimedes. Give me a lever long enough and a fulcrum on which to place it, and I'll move the world, right? So we're and a lot of times leaders rely on intuition and really fail short because they don't have the systems thinking and able to apply it. And so systems resist, they move, they push back, and then they stabilize system, and you can't really discern what's happening. So part of that is the axiological work, the philosophical work underpinning it, but it's also how you use your network, right? Who are the people? What are the roles that they're playing? And so levers that are designed supposedly to lift people end up oppressing people because people that work in systems are dehumanized. Our goal, that lever you'll see, is where you place the lever, but the arm is the people. Our goal is to move that lever to the proper way. One of the ways that we do that is we're working in complex adaptive systems, which have very specific criterion, one of which racism, the complex adaptive system. So we've moved to Howard County, the wealthiest county in America, one of the wealthiest county in America, certainly wealthiest in Maryland. We don't have racism. Well, it turns out we do. So there's a way that you begin to navigate complexity. And one of our big things is, because racism is a complex adaptive system, it requires the tools of complexity to navigate it. Said in layman's terms, it's whack-a-mole. You hit it here, it goes up someplace else. So it turns out there's some really good tools that we've been practicing for about 5 years now. This is the Knevin model. And if you're trying to move a complex adaptive system, but you think you have a clear analysis or that an expert can lead you, you're gonna fail, right? Because they have certain protocols there in the blue. If it's a thing that you always do the thing that you know. If you want to analyze something, that's fine. But if you're on this side of the domain, the complex and the chaotic, those tools simply do not work, right? So that's what we know. We also know that movement cycles come and go. We're at an empathy deficit, as studied by some researchers out of Stanford and Wellesley, that the highest empathy for white folks ever was I think 20% of any empathy from microaggressions all the way up to seeing people murdered and being able to call it that with George Floyd. And it's retreated dramatically since then. So we have to know what our movement cycles are, and we have to be able to anticipate some of the places that they'll take us. I'll just say that before I pass it to Sabria to talk a little bit about some of the data, I just want to flash the slides. I don't have time to go through them, but when we work in complexity, we look at constraints, whether we tighten or loosen them. In complexity, we look at connections and exchanges, all based on network size. We look at the boundaries. We look at attractors, right? And we do this simply because there's so many places to play in movements, and most organizations are not movement oriented or network oriented, and so we don't have shared infrastructure. So our tools are looking at the infrastructure of change as well as the structures and the methods and how we use the things underlying to move that. And so we really want to be master facilitators. And the other slide I wanted to show you is how we traditionally move movements. Has to be different than organizations, right? Because some structures are good at some things, others are good at others. And so these are the ways that we move in very intentional ways to be able to move the needle. And before I let Sabria take over here, I'll say, Donna, if you're there, can you talk about some of the organizing work we've done, just 2 or 3 minutes, and we'll come back in questions so I can make it real before we go to the data, both in public safety around story gathering, as well as in Howard County. If you want to chime in for just a moment, and then we'll go to Sabria.
Before we do
Sure.
that, Michael, the slides are too small and people are sending me notes. They can't really see them. Is there another way you can share that we can see the whole slide on the screen instead of like, yes, it's a little light, but at least we can see it better now.
Yeah, I was
Thank
having
you.
trouble. I was having trouble scrolling through with the full
I
screen.
know,
It
I
seems
know.
to be working now. But
Yes.
but before I share, Donna, do you want to say a word about our organizing, and then we'll go to Sabria.
Sure. So we did, well, two major initiatives. One in Baltimore City, where we focus on police reform and how we were able to collect stories throughout neighborhoods in Baltimore City to really inform what was happening with policing, which ultimately brought that collection of those stories was really what ultimately brought about the consent decree that's currently taking place in Baltimore City. But as we continue to do that story collection, it's continuously like shed a light on what's been the truth of what's happening throughout this consent decree process. And so continuing to do that data collection through stories really informs the narrative behind what's happening with the consent decree and what ultimately public safety is for what it means for communities. And likewise in Howard County, that has this, racially diverse community, but the truth behind what residents in the community were actually experiencing was something different than what the county itself was touting.
Yes, yes, that's a good point. I did want to say, I'm going to move to Sabria, that back when we did the community health equity reports, is Dr. Wolf on the phone? I don't see him, but the official report of the city was 20 years life expectancy gap. This is a critical thing. The system pushed back because what we found was a 30-year life expectancy gap, 29.6. But they gerrymandered the data so that it was only 20, and it remains that today. This is an important point about the role of civil society versus public sector activity. We're happy to work with folks, but we understand that we have to place lever and pressure on certain points. So for that, we did a groundwater analysis with Howard County that is an homage, first standing on the People's Institute shoulders and the Racial Equity Institute, and then the healing stuff with that Dr. Christopher champions with the Soul Focus Group. So we integrated that along with small S spirituality through virtues. And then we got to our data. So Bria, can I tee you up here and you can I'll move the slides for you. Yep.
Sure, thank you, Michael. So as mentioned earlier by Michael, part of the work that we were doing was partnering with Howard County to look at some racial equity issues within the county, because again, Howard County is one of the wealthiest counties in the country. It is usually ranked first among all the counties in the state of Maryland. And as you see here, kind of highlighted on this particular slide, in 2021, Howard County was ranked as the 8th best county in the US in terms of healthiest county. It was also ranked in 2021 Money Magazine as one of the best places to live, and also ranked as one of the best places to raise a family. And actually, I think they just released a new 2022 report where in 2021, Howard County was ranked number 8. This year in the report, Howard County is actually ranked 18th, and part of that is because of a decrease in their actual equity score and how they did their methodology. Michael, you can move to the next slide.
Oh, there's trouble in paradise.
If it will let you.
Hold on 1 second. Let me try again. Nope. Sorry.
Okay, let me see if it will let me share and move through.
I got it back. It's just
You
going to
did?
be small. Okay, you can go ahead. Yeah.
Okay. Okay, let me get down here. Okay. Yeah, so here's information I was just sharing with you all about where Howard County ranks in places. in terms of the state of Maryland and then also nationally. If we look at Howard County, when you compare it to some of the other most populous counties within the state of Maryland, just to give you all a little background, you see you have socioeconomic indicators. So here we have having a bachelor's degree or higher, we have median household income, and we have the annual unemployment rate. And as you see here, looking at Howard County compared to the most well-known city in Maryland, Baltimore City, and then other counties such as Prince George's, Montgomery, Anne Arundel, and Baltimore County, you see that those who live in Howard County are doing pretty well in comparison to everyone else across the state. They have a higher percentage of Howard County residents have bachelor's degrees. The median household income is the highest in the state. And the annual unemployment rate is the lowest in the state. And so looking at this data at this level, this looks pretty good. And so the assumption within Howard County was that, you know, everyone who lives here is doing okay. Again, going back to the rankings of best place to live, best place to raise a family. But this information was not true for everyone who lives within the county. Here, just sharing a little bit of health data, life expectancy data. Again, Howard County overall in general, one of the highest life expectancies within the state of Maryland. But when we start to look at this data and break it down a little bit by race, we see that there are differences in terms of life expectancy between white residents, non-Hispanic white residents of Howard County and non-Hispanic Black residents of Howard County. And that difference that we see here is only second to Baltimore City, which is known to have some of the most, the highest issues within the state in terms of disparity and inequity across health outcomes. If we take it a step further and dig deeper into Howard County and look at by different districts, we see that there is a range of differences in terms of life expectancy based on place, based on where you live. And so this data here is presented by census tract data by district. And looking within these districts, you can see that in general, yes, there's a life expectancy of 82 years, but again, that number varies depending on where you live within Howard County. If we look at other health data, in particular birth-related outcomes, and we look at this by race and ethnicity, again, this here is just within the county, we see that there are racial differences in birth-related outcomes that you see in other places. So in particular, we see non-Hispanic Blacks in the county, higher rates of infant mortality. You see higher rates of low birth weight. You see among non-Hispanic Black and Hispanic populations within the county, late or no prenatal care. And then you see this large number, 40%, 2 in 5 births that occur within the county among non-Hispanic Blacks be C-section births, which we know increases the risk for having severe hemorrhage or post-delivery complications, which is one of the leading causes of maternal mortality, which we know that there are inequities when it comes to that among Black or African-American communities. So in addition to the health data, we also looked at some educational system data or indicators. And so here, this is just an overview of who is in the populations that make up the Howard County school system. You see 38% non-Hispanic white, a quarter non-Hispanic Black. You see Asian population makes up almost a quarter as well, and then our Hispanic population within the county. But again, when you look at the actual outcomes that are happening or what's occurring within the school system, again, we see a discrepancy or difference between the different populations based on race. And so here, if we look at the likelihood of students having a worse academic experience compared to white students, we see, just to highlight a couple of things here, non-Hispanic Black students are 5 times more likely to be suspended or from school. Hispanic students are 5 times more likely to drop out. And again, this is just within the county. Again, going back to the general rankings of best place to live and best place to raise a family, we see that that's not necessarily the case for everyone, again, who resides within the county. Okay. Here, just to show a little bit of what this looks like in terms of using the terminology of white advantage. And so this is comparing Black students to white students in the county and Hispanic students to white students in the county. And so what this is showing is that if Black students or Hispanic students actually experience these outcomes in comparison to white students, so let's just say kindergarten readiness, white students are, experience this at a rate of maybe 55% compared to a Black student who would experience this in the county. And so this goes across, as you see, there's advantage across every one of these educational system indicators here.
Just a heads up, 1 more minute for presentation.
Yeah.
Okay, let me skip through.
Yeah, go ahead.
So really quick, this is just housing data, housing indicators. This is another system that we looked at. So this is the percent of applicants who were denied a home loan within the county, and then the percent of applicants who actually, those who received loans, received high cost loans. And so again, we see how there are differences within the county based on race and ethnicity. And I will turn it on. Go ahead, Michael.
Yeah, I was just going to say, we're out of our presentation time. The next part we wanted to talk about is where we want to go. Can you go to the next slide? But just wanted to tee up Antoine Wallace. Yes. And Antoine is going to help us take our next step. And so we can talk a little bit about, as we begin to answer questions, the next step of where we want to go. And I want to highlight Antoine's work in New York, where he was able to displace FBI statistics as primary data source and to really turn back to listening to community. So Antoine, do you want to say a quick word on that? And then we're going to go to questions and then close out.
Yeah, good morning, everyone. I think I'm going to do a little bit of synthesis here more than I'm going to do and talk a little bit about forecasting. So I think across all of the phenomenal work that we've seen today is that as we look at the administrative data sets of current systems, what we see is a profound signal of inside of racial disproportionality, right? And as a place to begin empirical inquiry into these public systems, respectively, the racial disproportionality becomes a place to start to begin to audit and to understand how those systems are currently deemed successful when we see such disproportionate numbers, right? And if we accept the premise that these systems are successful when in the presence of racial disproportionality, even as it relates to some of the demographics of race, the intersectional lens that we lay upon across all of these start to give us a level of precision about who is doing less well in these systems. The work that I have done around the point of empirical data and looking at racial disproportionality as a gating mechanism to systems change, which is about changing the metric framework by which these systems see themselves as successful, and using the racial disproportionality inside the dominant frame to say, if this system is doing well, we should expect the 46% that was outrageous to be the folks. What would we transform that system, and how would we transform those systems if we place the lived experience of those 46% folks as the measures and levers of success for that system? And what would then need to be displaced? And so we start to think about the need for new sources of data and administrative data in particular. And the work that I do is really engaging folks with lived experiences, subject matter expertise. So then you go to those 46% of the youth in Louisiana who I actually happen to support through other work, and you ask them what do they need to feel safe in order to participate in the public systems, and then what do they need to thrive. Using this framework, we engage folks in New York City. Safety was a multi-dimensional factor that was mostly economic, and the three pillars of that economic safety metric was economic security, economic readiness, and the local economy, and the ease with which people could participate in that work, right? Given some of that other work. And so I will put a final point there to stop, and that's where we are arcing to be able to have empirical data to support those.
Thank you, Antoine. We're a little over time, so thank you, Michael, and your team. It was a great informative presentation. I'd like to move us to the Q&A. I see John Davis has a question. John, you want to unmute and ask your question?
Well, I just, as I was listening to Michael, I was thinking the way it was presented initially, it seemed like a very big project. It seemed very academic. I wanted to know how large was your team and what type of training did they have to go through in order to get set up and implement this process?
No, John, actually it was just the opposite. We move in network principles of decentralized things. So what we're doing is working in various decentralized projects, and our organization serves as a hub and a core. But we do have lots of training. We do applied complexity training with a partner out of Canada. It's 10 weeks. We just ran another course. We're having one in the fall. And no, this is all organizing centric, right? Like we are primary organizers. And even our academics are disruptors in terms of how, you know, they engage. And it's all about creating leverage for community. We set the levers by understanding the data, but the people that move the lever are the arm, the bar. And so you can have levers all over the place, having figured out where to apply pressure. But if you don't congeal the people, it doesn't pop, it doesn't move. So yeah, that's how I would respond to that.
And just a follow-up, are all of your stakeholders, was it hard to convince stakeholders that there is a problem because your numbers look so good on the surface?
Yeah, well, it depends on where you're talking. In Baltimore, of course, it wasn't hard at all because they're living that experience. In Howard County, we had an enlightened gatekeeper who had no fear. And first thing I asked her is, do you need cover? She was like, nope. And so she was able to convene across sectors in her system. It was also a trusted thing. And I'll say that about public health. You know, public health used to be the place where we could sneak in equity, right? Because all health is all policy is health policy. Why we coined the term equity in all policy as an homage. But we live in an era where masks and spittle at town hall meetings and screaming and death threat exist. You know where we found as a great leverage point? The library. Everybody goes to the library, even the far right. And so at the library, you know, because you're learning, you're storytelling. So they were the ideal partner to move this work forward. So they convened 40 stakeholders that were part of their Racial Equity Alliance. We brought the Racial Equity Institute, a sort of second gen from the People's Institute. Oh, I love y'all, but you know, they like boot camp and I don't want to live at boot camp every day. And then we brought in the Soul Focus Group, who's been doing you know, work that's like life coaching ever since that entire genre of people that went to South Africa when Mandela came out, and that life coaching thing about his will and how he got in his head and made things happen. They've been doing it that long. And of course, they're all also long-term People's Institute folks, but are all taking the next generation. So our big radical act is seeing racism as a complex adaptive system, adding anti-racism, the next gen, plus the tools of applied complexity, because no one's going to sit through all this theory. Right. We just wanted you to know that it's there.
Thank you very much.
So we will be moving on to the breakout groups. Thank you to both teams for such amazing presentations. As a reminder, the breakout group questions, which I'll put in the chat right now, are discuss how the data issues that surfaced in the presentations could inform your work for an equitable recovery, as well as discuss other ways you might use data to drive and support your local action. So we'll have 15 minutes to discuss in our breakout groups.
And please decide who will report back.
Kevin, if you're on the line, please make sure to join your breakout group.
From Leroy in Mississippi. And he spoke of just fundamentally what's going, he's listening to us from Louisiana, because what happens in Louisiana is probably also happening in Mississippi. So there's room for collaboration and shared learnings there. We went back to the data, that the data, how the data was used to reflect positives, but in digging deeper, one could see the differences that it was not as positive when we talk about Maryland. And how do you address things like Baltimore County? You know, when you have all of those positives and then you pull up Baltimore County and it's not as positive as the rest of the state. The other question was around the HOPE data. How is it being used? Is there a gap? Is there a room for improvement in that data collection? Is there need for more data to be collected from the organization that identifies specific problem areas? Can the people sponsoring the HOPE, collecting the HOPE data, do a better job in creating or facilitating data that we need that we're currently not getting? And then there was also discussion about, for the Maryland group, how do you go before elected officials with data? Because, you know, this is how they fight back and they go, hey, look at our data. We're doing great here in the state. So how do you go before them when the data looks so positive until you drill down? How do you convince them to listen when they're fighting back saying, oh no, as a state, we're doing great? How do you convince them that there are specific issues? I think I got all of them.
Thank you, John. Who else would like to present from their group? Sarah, your group?
Sure, I can give it a stab. We were just saying that we were so in the conversation that we were only taking some sporadic notes. So Sarah and Michael, jump in at any point. But we had some conversation just about the work that was moving in our local places, processing around education system indicators. I was specifically sharing about some of the gaps in disaggregated data in our education locally, and how the presentations were inspiring some ideas about how we can advocate for more detail. We had some great conversation about sense making with data. I think we were absorbing, Michael, your perspective around, I love how you talked about stories moving to narrative and how that gets translated into and back into community, processing the importance of organizing. Sarah asked a great question about, like, okay, we want to do more participatory research in collecting data, but there can be challenges with getting people to be able to participate because of the barriers to participating. So have we had success with seeking funding around that? And we ended up talking more about how that can be a function of organizing itself. Sarah Sarah, Michael, anything you want to
Yeah,
add?
no, great job. Sarah talked about organizing as well, and that really resonated with me. I think I would say the lift about the data and the organizing, though. I was sharing about how Antoine's work with, instead of focusing and centering FBI statistics, ask the people most affected in public housing about safety, right? That's powerful. Also, the fundraising and the decentralization of that, where you actually raise money for organizations, and as a coordinating organizations get a VIG. That's powerful. We did that with our summer programming. About 40% of our budget went out to organizing. And that's important around the story collection piece, because we say stories collected become narratives, narratives collected becomes culture, cultures collected become identity. We're all multiple identities made up of different, HBCUs and researchers, whatever. And so if we're trying to change culture and identity that are problematic, we have to look at that pathway of story. But we can ask qualitative data as well as quantitative and look for patterns to shift, and that we're not looking for major shifts, just small, incremental, and changing patterns and not solving problems. So yeah, it was good stuff.
Great. Absolutely. Wonderful.
Thank you. Do we have another group that wants to share?
Yeah, I'll talk a little bit. Michael, thank you for always putting a mark on my back about the FBI statistics. Thank you, I appreciate that. But it does get to the point of having a goal, right? Which is for systems change. I really did want to displace the criminal lens that was being placed on poverty, and there was a need to move from the very high level to a more to the lived experience level of what it meant to be safe in the pillars under safety. And that has resonance inside of the conversation that we had from the respective areas. So you think about a state like Connecticut that is on balance sheet, right, as an administrative outcome is successful for being a very wealthy state. And then you think about California, also on the administrative platform is a wealthy state, as is Maryland, right? But when you start to look at the disproportionality of folks who are doing less well in those states, the administrative data don't necessarily make themselves available to provide an opportunity to critically inquire about how well those folks are doing in those places. And so we talked a lot about what that meant to be able to displace those current administrative data sets and creating transparency. We talked about what the level of disaggregation, but also the sources of that disaggregation, right? Yes. Often we are looking at and to institutions rather than to people. And we're looking to folks with credentials rather than folks with credible stories and messages. And so we all bring our own inculcated dominant narrative and norms to this work rather than thinking more about liberation frameworks that lie inside of the stories, wherein quantitative data is seen as superior to qualitative data. And stories aren't necessarily a stackable and a deuceable metric that we see as successful. And inside of those stories actually might be some of the systems transformation work that we want to see, and not the tinkering, right?
Antoine, we're running out of time, so sorry.
That's it.
Thank you, Antoine. Very interesting. You're doing wonderful work. Unfortunately, we do not have more time for reporting back. If you want, you can add it to the chat. We also print the chat and keep it for our records. Thank you to both teams. You were extraordinary, very provoking, a lot of great ideas and thoughts on how to move forward and be effective. I just want to remind everyone that in the next presentation, we will have Selma from Alabama presenting, as well as Health Equity Solutions from Connecticut. So also wanted to remind you, we're trying to develop a website for Leveraging Hope, and we wanted some photos from you doing community work. If you can't send that, we haven't received many, we can always go to your websites and use what we find there, but we still need a release. So please send in your photo releases to Bethlehem. And we want to get that, started and really provide you a nice website with your work. I want to move on to Yvette, who has an announcement for the group. Yvette?
Yes. Good afternoon, everyone. And I'm sorry, all my buttons are moving slow again. I want to thank everyone for all of the work that we've done together thus far. My ride with you on this Leveraging Hope project is ending at the end of the month. I will still be around. I still consider you all community and family. And so if you need anything, feel free to send me an email. Let me know. I will be around, and I just really appreciate the work that we've been able to do together and the community that we've been able to build around this Leveraging Hope work. So thank you all so much.
Thank you, Yvette. You've been wonderful. Your sense of empathy and compassion and the love that you share for the work comes through. And we appreciate you very much, as I'm sure everyone in the group does. And Michael and Alma, thank you so much for your time and the information you shared with everyone, and to everyone else for your attendance. And have a great rest of your day.
Thank you.
Thank you.
Thank you all.
Thank you.
Thanks, Yvette.
Thanks, Yvette. Take care.
Good luck, Yvette.
Yeah, bye-bye.